Pathogenesis of pulmonary tuberculosis. This is the pictures in which show infection before activation of cell-mediated immunity, and the second is initiated and consequence of cell-mediated community. Pathogenesis. First of all, macrophages enter and replication into macrophages, development of cell mediated immunity, T cell mediated macrophages activation, and killing of bacteria, granulomatous inflammation, and tissue damage. Second, entry into macrophages, entry of myobacteria into body tissues. Here, myobacteria are engulfed by macrophages. Replication into macrophages. Inside macrophages, they inhibit the fusion of the lysosomes with the phagocytic vacuole. Myobacterium persist and proliferate inside macrophages, it eventually resulting in bacteremia and seeding of the organism to multiply sites. Development of cell mediated immunity. This occurs approximately 3 weeks after exposure. Myobacterial antigens reach the draining lymph nodes and are presented to CD4 T cells by dendritic cells and macrophages. Macrophages secrete interleukin 12. Interleukin 12 converts CD4 plus T cells into Th1 subtypes of T cells. These of Th1 cells secrete interferon gamma. T cell mediated macrophage activation and killing of bacteria. Interferon Y gamma activates macrophages. Activated macrophages in turn release a variety of mediators and produce following effects. TNF, which is responsible for recruitment of monocytes, which in turn undergo activation and differentiation into the epithelioid histiocytes, increase nitric oxide no levels, which is important in killing of myobacteria, antimicrobial peptides, defensins that are also toxic to mycobacterial organisms. Granulomatous inflammation and tissue damage. Activated macrophages differentiate into the epithelioid histiocytes that aggregate to form granulomas. Some epithelioid cells may fuse to form joint cell in many individuals. This response to stops the infection in other individuals with immune infection progress and ongoing immune response results in cessation necrosis. In summary, immunity to a tubercular infection is primarily mediated by Th1 cells, which stimulate macrophages to kill myobacteria. This immune response, while largely effective, comes at the cost of hypersensitivity and the accompanying tissue destruction. Defects in any of the steps of Th1 T cell response, including interleukin 12, IFN, YTNF, or nitric oxide production, result in poorly formed granulomas, absence of resistance, and disease progression.